So I wanted to mention two quick things. You may be thinking, I don't have fear of recurrence, so maybe I'm just going to go. And what I'm going to say is that all of the coping skills that we will talk about today are applicable to all of life. So whether you have cancer or you've had cancer, or whether you're a cancer caregiver, whether you're a healthcare provider or a comedian or a researcher or whatever, all of the skills are applicable to any source of unwanted stuff in our lives, right? And then the other thing that I wanted to mention is Dr. Einhorn had mentioned John Cleland, who was the first person who he cured of testicular cancer. And my husband is good friends, or was good friends, with Mr. Cleland, who was his coach. And so the reason why I bring this up is because the reason why I did not get a chance to rehearse for our talk today, which you're going to tell I didn't rehearse, is because my husband drove me down here today, because we only have one car today, and he was fit to be tied about something that had happened in his life. And so I gave all of my full attention to him, because that's very values consistent for me, which we'll talk about here in a minute. But because of that, I didn't get a chance to rehearse. So it's going to be a little rocky, but I'm hoping that you will meet that with compassion, which we will also talk about a little bit later today too. And I do want to let you know that my husband does not practice these skills that we're going to be talking about today, so maybe I need to get him turned on to some of that. Let's see if I can figure things out. Okay, so anyway, just this is going to be an interactive workshop. It's all very invitational, so if there's something that you don't wish to do, I will respect your decision on that. But you'll get the most out of this session if you're willing to try some of these things that we'll be talking about. And none of the coping skills are complex. They are all very common sense types of skills, but things that you just may not be doing a lot of right now. So I'm hoping that you'll meet this with just kind of interested curiosity and some openness and willingness. So mainly we're going to start off talking a little bit about fear of recurrence, but again, then we'll get into the coping skills. I'll also give you an invitation if you have a pen, and if you don't, I'm a former journalist, so I've got like 85 pens in my bag. I can bring you one if you raise your hand. But I'll give you a chance to assess your fear of recurrence, or if you are a caregiver, you can fill it out in terms of how fearful you are about your beloved's cancer coming back. And then we'll talk just a minute about some research results from my program of research, and then we'll get into the coping skills. At the very end, I would invite you to fill out the survey, because I appreciate feedback, like Dr. Frankel had talked about a few minutes ago. So just to kind of get us started, a few facts about testicular cancer, which you all probably know because you are the experts. Testicular cancer is the most commonly diagnosed cancer in young men between the ages of 20 and 34 usually, but not always. And many men have been diagnosed with testicular cancer worldwide. About 7,000, to my Clint Carey would know better than I, but I think about 7,000 men were diagnosed last year just in the U.S. alone. Or 9,000, I guess I already put that on the slide there. So about 9,000 diagnosed are expected to be diagnosed this year. Fortunately, 95% of patients with testicular cancer are cured, resulting in an increasing number of testicular cancer survivors. And even if cured, testicular cancer survivors, as many of you know, are left with a lot of symptoms and side effects that you did not want to have. There's a lot of fatigue, there's a lot of neuropathic pain, and even increased risk for things like cardiovascular disease and some other problems. So even though it's a highly curable cancer, it's a weighty cancer in terms of a lot of stuff that that our friends are stuck with for quite a while. So I also wanted to mention that even though most testicular cancer survivors do quite well emotionally, there are increased risks for psychological distress, including depression and anxiety, as you can see, on this slide. Anxiety tends to be the most common problem, in comparison with depression, and the levels of anxiety up to about 21% of testicular cancer survivors have clinically significant symptoms of anxiety. And that is quite a bit of a larger prevalence of anxiety than compared to the non-cancer population. So, and also in terms of related to anxiety, 1 in 3 cancer survivors have pretty high levels of fear of recurrence. So I'm guessing that at least a few people in this room have probably been kept up nights occasionally about wondering, is the cancer going to come back? What would I do? How would I pay for it? How would it affect my friends and family? Things like that. So we'll kind of transition now specifically to fear of recurrence, and I've given you the kind of the agreed upon definition here. That's the fear, worry, or even concern that's relating to the possibility that cancer will come back or progress. And fear of recurrence is very common at mild levels. Almost everyone has, if they've had a diagnosis of cancer in their lifetime, probably is going to have fear of recurrence at least sometimes. Oftentimes it's triggered by a doctor's appointment, when you're going in for testing and things like that. But the triggers can be multifactorial. I mean, some people who live in Indianapolis, whenever they drive downtown, where they came to see Dr. Einhorn or Dr. Carey, when they even get off of the interstate on the exit to get, like they were coming to the IU Simon Comprehensive Cancer Center, just that alone can be enough to kind of get the anxiety revved up. So I would invite you to think about, what are your triggers? I mean, is it, whenever you drive, in a direction toward the cancer center? Is it, just when you're having appointments, or is it something else? Sometimes certain smells, sometimes a certain song that you hear on the radio can be a trigger as well. And the reason why identifying our triggers is so important is because if we can be really aware of what triggers us, then it gives us a chance to be more proactive, where it's like, okay, I'm driving downtown today, so I know I'm probably going to have that, that heart racing that's going to come up. So what I'm going to do is I'm going to do a little, mindfulness practice before I get in the car. Or I'm going to make sure to listen to my favorite music on the radio that always helps me to feel centered and things like that. So we're just trying to be a little bit more proactive. And then also, as you can see, that the trajectory of fear of cancer recurrence remains pretty stable over time. It tends not to go away without some specific intervention. And so it's one of those things that a lot of survivors struggle with for the duration, of their lives at various levels, depending upon what's going on. And fear of recurrence also tends to be one of the most frequently endorsed unmet supportive care needs for cancer survivors, not just testicular cancer survivors, but all cancer survivors. Here I've listed for you just a few examples of some of the correlates of higher levels of fear of recurrence. It tends to be more common with younger survivors, particularly those who still have dependent children still at home, and it's understandable why, right? Because when we're parents, we want to make sure that we're going to be, able to be a good guide, for our children, and to see them, through their growth and their development. And so that's why a lot of survivors who are of childbearing years and who have young children at home are still, pretty worried about their cancer coming back. Also, we talked about triggers, survivors who have more symptoms. So symptoms like fatigue or pain, that every time you're noticing, it's like, oh, I'm so tired today, or, my neuropathic pain is keeping me up nights. That can be a trigger for fear of recurrence as well. And then I've listed some of the other factors for you here. And I'll shift down to the passive avoidant coping at the very bottom. And that reminds me of something that Dr. Frankel said in his talk. He kind of talked about, when we're a little bit more passive, when we go to talk with our doctors, our medical needs probably are not going to be as well met, and our outcomes are not going to be as good. So all of the coping skills that we'll talk about here in just a couple of minutes give alternatives to that passive and avoidant coping. I also wanted to mention there, because it's been a little doom and gloom for the last couple minutes here, but I wanted to let you know that there are some protective factors against fear of recurrence. And if you already have some of these, then maybe we can just kind of play those up for you, getting a little bit more committed to some action in some of these areas. So one of the biggest protective factors is, having strong faith. This can be, usually it's related to religion, but not always. It can be related to just anything that you have strong faith or strong commitment toward. Another protective factor is just social support and having the right amount and the type of social support that's most meaningful to you. Relationships and commitments that with people that you love and care about and who love and care about you. That can be really protective as well. And finally, this one is usually more of you either are an optimist, a glass half full person or not. So there's not a whole lot that we're going to do about this. I'm almost 60 years old, so I am what I am. I'm probably not going to all of a sudden turn into a pessimist. I was kind of born an optimist. I'm probably always going to be one. But if you have a pessimistic style, that there are probably some coping skills that we'll talk about today that you could start doing a little bit more of to kind of balance out, that pessimistic style with a little bit more of an adaptive, focus in your coping. So I'll just take a couple of minutes to tell you a little bit about some of the research that my team and I have conducted with regard to fear of recurrence. This study that we'll be talking about was just with breast cancer survivors, but I feel like some of the results are pretty applicable to cancer, survivors of all types of cancer. So the setup for this study was, I've been working in cancer care for about 27 years, and early in my career, before we knew much about fear of recurrence, we just knew that people were suffering with it, but we didn't have any evidence-based treatments for it. What I discovered is that what I was doing in my clinic a lot, cognitive behavioral therapy, which some of you may have heard of, was just kind of falling flat with a lot of the cancer survivors I was working with. And it's because cognitive behavioral therapy, if not delivered, in a really flexible way, can come across as not really acknowledging the realities of cancer and the fact that it could come back. I've never met an oncologist yet who gives an ironclad guarantee that somebody's cancer will never come back. Have you? Raise your hand if an oncologist has ever given you an ironclad guarantee, right? Yeah, it just doesn't happen. And because of that, there's always going to be a sense of vulnerability for a lot of people. And that's why cognitive behavioral therapy just was not landing very well, and I knew something else was needed. So I went to the literature, the scientific literature, and started, doing lots of training and reading and looking at theory. And what I discovered is that a newer approach, a more modern form of cognitive behavioral therapy called acceptance and commitment therapy, was landing much better in my clinic with the patients that I was serving. And it's basically all of the skills that we're going to be talking about today all fall under this acceptance and commitment therapy, or ACT model. So what you're going to be getting today is ACT light, since we're just going to do it in an hour. So in this randomized pilot study that we conducted, we enrolled 91 breast cancer survivors who had completed their treatment, and their oncologist had told them that they were cancer-free and that they were good to go. Now, many of them were still struggling with a lot of side effects from their treatments and things like that, but in terms of, cancer, they were allegedly disease-free. And we randomly assigned all of these survivors to one of three programs, either ACT, which is what you're going to be getting a version of, or CBT Lite, which was what we called survivorship education, but it had a lot of CBT principles in it, or enhanced usual care, where we just brought people in for one quick session. We gave them some reading materials, kind of told them how to use those materials to their advantage. The other two groups, ACT and the survivorship education, met every week for 6 weeks, but the enhanced usual care just met the one time for brief coaching. And so what you can see here, and I'm going to kind of walk and talk when I do this. I don't know, do I have a pointer? I don't see one on here. So what you can see here is that, can you still hear me okay? Everybody started with pretty high levels of fear of recurrence. You can see all the scores are pretty high, but we had a really nice drop, in the ACT group. All the groups had a little bit of a decrease for sure, but there was more of a significant decrease in the ACT group at the 6-month follow-up. It took time for that to happen, but the drop, kept happening this was at post-intervention, 1-month follow-up all the way to the 6-month follow-up. And part of that is because people were continuing to use those skills because they're so common sense. They don't take any supplies or any worksheets or any papers to use these skills. And as these women continued to cope in these very adaptive ways, consistent with their values, living in touch with the present moment, what we found is that their fear of recurrence continued to drop over time. And then what this slide represents is we assessed everyone in the study for their level of cancer-related avoidant coping, which is, what we have been talking a little bit about, in terms of, Dr. Frankel had mentioned avoidant coping, and we've talked a little bit about it here. But you can see that there was a pretty big decrease in the ACT group in their avoidant coping. They were finding more adaptive ways to cope so that they didn't have to cope with avoidance by trying to ignore or distract themselves or try to forget about, because when we're in pain or when we're suffering with something, trying to forget about it is just not very easy for me. I don't know how it is for all of you, right? So anyway, we think one of the reasons why the outcomes were so beneficial in the ACT group was because of the way avoidant coping was reduced. And so I put this on just because, coping with avoidance with regard to anything cancer related is kind of like playing whack-a-mole. And then, so it's like you're trying to get rid of it over here, and then before you know it, it's going to pop up over here, and oh, there it's back again. Oh, now it's over here. And then your life becomes more about, trying to figure out where it's going to hit and how you're going to take care of it, rather than living your life and, being involved with the people and the causes that matter to you, doing the work that makes your heart smile, or, whatever is most important to you. So all of these skills that we're getting into here in just a couple of seconds is about putting the hammer down so that our life isn't about playing whack-a-mole anymore. Our life is about living and being fully present, in our lives in ways that are meaningful to us. So these 6 skills that you see listed here are the 6 skills of acceptance and commitment therapy. And there's lots of different ways to cultivate, these skills. So we're going to do a little experiential work if you're up for that. So this is the point where I do like to walk around a little bit more. Well, let's kind of go back here. So mindfulness is basically about being more in touch with the present moment of our lives. I don't know about you, but when I am struggling or suffering, I'm usually either thinking about the future, which isn't here yet, which cannot be predicted very readily, or I'm, kind of poring over something from the past, oh, I wish I would have said, or, oh, I wish I wouldn't have done that, oh, I embarrassed myself, oh, I dropped the ball, some of that past-oriented stuff. And I have found, and it'd be interesting to hear from all of you too, I have found that when I am fully present in this moment, looking at the eyes of this beautiful woman in front of me, right? Yes, when I am truly here and, looking at all of you, even if I'm nervous as hell about presenting, public speaking and, all of that kind of stuff, I don't know. I feel a little bit more grounded. I feel like my feet are on the ground when I'm really looking at the people in this room. So that's what mindfulness is. And we'll talk soon about, there's lots of formal mindfulness practices that we can do if we're into that kind of thing. I am. So I have a 30-minute daily mindfulness practice where I just literally sit and focus on the present moment of my life and my breath and that kind of thing. But some people are not into that at all. They think it's a big fat waste of time. And I'm not here to change anybody's mind on that. But there are informal ways to be mindful. So have you ever held a newborn baby? Raise your hand if you've ever held a newborn baby, right? You were probably pretty mindful when you were doing it because the baby is right there in your hands, so beautiful and so mesmerizing. That's mindfulness right there. It's informal mindfulness, but that's mindfulness. Ever have the first peach of the season, the first juiciest ripe peach? Oh my God, that is a mindful moment, right? To just feel the texture of the pulp of the peach on your tongue and to taste and savor the sweet, nectar of the peach. Those are mindful moments. You could probably think of 1,000 other ones, from your own life when you were really present for something. That's what mindfulness is. And when we start to expand patterns of mindfulness in our lives, life just seems a little bit more meaningful, At least for me. So, don't take my word for it. Try it for yourself and see. Values clarification, we're going to do a little bit of that here in just a moment. I would love for all of you to leave here with a list of 3 of your core values that can serve as a foundation and a guide for you so that no matter what kinds of crazy shit gets tossed at you in your life, and there's probably going to be a lot of it, I want you all to have that firm focus on this is what matters to me, this is what I want my life to be about, this is what is most meaningful. Then, no matter what kinds of crazy stuff comes your way, you always know the direction that you're going to go in. Do you guys think I'm full of it? A little bit? Just a little? All right. And then committed action in service of our values. We're going to have a little exercise related to that here in just a moment. Acceptance. People have a lot of baggage about the word acceptance. Acceptance is not about liking, endorsing, or approving of anything. Like, I do not approve of testicular cancer. I don't want anybody that I know. I don't want any of you to have ever had to deal with testicular cancer. I do not approve of testicular cancer. And yet, it happened, right? It's happening. Somebody's being diagnosed with it right now. So it's not about liking it. It's about what's already here. And so how can we proceed in our lives in a meaningful way by just accepting what's here and then still moving in a direction that matters to us. And then cognitive diffusion basically means not getting caught up in the content of our thoughts. Because I don't know about you, but I have had some crazy thoughts today. Like, one of the thoughts I'm having right now is, I look a little bit bloated. I bet they think I'm fat, right? Like, I'm having that thought, but I'm not going to get caught up in that, because if I was caught up in it, then I would have stayed home. I would have called Clint Carey, and I would have said, ooh, sorry, Clint, I'm not feeling well today, so you'll have to fill that 90 minutes. Right? But it doesn't matter what kinds of crazy thoughts we have. They're going to be infinite amounts of crazy thoughts or disruptive thoughts. But if we can just start noticing and labeling thoughts as thoughts, it gives us an opportunity to get back to doing those things that are most meaningful to us, consistent with our values. So, and then the last one on here is perspective taking. So it's like not letting what we think, we should be doing in our life, not letting that getting us off track. It's about defining truly what's meaningful to us and just kind of taking in the perspective of, other perspectives, when you're dealing with really challenging situations. Perspective taking can be really helpful in relationship as well, if we can just kind of acknowledge that our partner has a different perspective than we have. So anyway, let's talk a little bit about mindfulness for a second. So and I would love to hear from some of you on this if you're willing to share, but tell me about something that you typically do that you've noticed yourself doing on automatic pilot, where you're not really very mindful, but you're just kind of getting through it. Anybody think of anything? A couple deep breaths? Well, that sounds pretty mindful though. But you do that, but that is true, because our body is structured so that we don't have to tell our body to breathe. But you just notice that you're just kind of breathing on automatic pilot. Is that right? Okay, yeah, right on. How about, what are some other things that you guys do on automatic pilot where it's like, oh my God, I was doing that, but I wasn't even paying attention?
Driving, going all the way,
yeah.
Realizing, making it all the way home and like,
how'd I get here, right? And that's so funny that you mentioned that, because was anybody else going to say driving? Yeah. Because I've done this workshop before, and almost always that is the number one thing that people say is driving, and it makes me want to stay the H home, right? There are so many mindless drivers on the road, right? Yeah. Anything else that you guys do on automatic pilot? Running? Yeah. And I would have to run on automatic pilot too, because it's painful. So I was like, I don't want to think. I just want to get through it. I want to listen to my, yeah, that's right.
When there's a task that I don't really want to do, I automatically pick up my phone and fill up the time so I can do it.
Yep. Exactly. But that you raise a really good point, which is some of these things that we're talking about. Now, running could be something where it is values consistent, if you care about your health and wellness and all of that. But a lot of these things that we do mindlessly, like you said, I don't really feel like doing this task, or driving, we do things that are not consistent with our values kind of on automatic pilot a lot of times. I mean, sometimes it can be to our peril, especially if we're driving, mindlessly. But it's when we're more mindfully and fully present with something, it's usually something that's a little bit more meaningful. Yeah, absolutely. And both of you talked about your senses, like the smells of nature and what you could see, and then just really like microscopically looking, at what's on the wings of the insects and things. And just, it's meaningful. Nature, more time in nature is meaningful to you, and photography is a huge passion for you as well. So these are terrific examples of how we can start being more fully present, getting all 5 of our senses involved. What can you see? What can you hear? What can you smell? If there's a taste involved, what can you feel with your own hands? That's a way to bring mindfulness to any moment that we find ourselves in. And so if you're willing to do, because we've talked a little bit about informal mindfulness, so if you're willing to do a formal mindfulness practice with me, we'll keep it real brief, about 3 minutes. But I would invite you to consider trying this if you would like. And so what I'm going to do is I'm going to close my eyes. You don't have to. You can practice with your eyes wide open if you'd like. But if your eyes are open, maybe adopting, kind of a soft gaze where you're not like reading something or, staring intently at something. And if your eyes are closed or open, maybe just noticing the felt sense of the body as it makes contact with the chair beneath you. Just noticing how your legs feel against the chair. Noticing the support of the back of the chair if you're resting against the back. And if you'd like, maybe even giving your toes a little bit of a wiggle in your shoes, if your shoes are still on. Just waking them up. This may or may not be the first time today that you've noticed your toes that are so important to us. And if your feet are on the ground, just feeling the stability of the ground beneath you, the floor of this Riley Outpatient Center, this safe space that has been reserved for you as part of this conference. And if you'd like, maybe even bringing a little bit of attention now to your breathing. No need to change your breathing in any way, just noticing it as you find it. Perhaps tuning in to the pace and the depth of each breath. And as thoughts come up for you, as they naturally will, maybe just noticing where the mind has gone. Like, yeah, there's a thought about blah-de-blah. And then seeing if you can just gently bring the focus of attention right back to the next breath. And maybe even noticing a little kindness for yourself. It's like, it's like this right now. And if you'd like, allowing your eyes to slowly begin to open, or maybe to open a little wider if they were open all along. And that was just a real quick mindfulness practice. And I find that sometimes for me, I don't know how it is for you, but I find that when I practice mindfulness, it helps to connect me with what's right with my body. I've lived with type 1 diabetes for about 50 years, and I've got, all sorts of, maladies that, that I hide pretty well, like all of you. But I remind myself, it's like, man, there's a lot of stuff about my body that still works pretty darn well, right? And I'm hoping that maybe you can cultivate, an acknowledgement of that as well. So, anyway, thank you for practicing with me, because I always get so much more out of practicing with other humans than when I practice, on my own at 5 o'clock in the morning at my house. So for the sake of time, we're going to kind of skip through the next couple of slides here, but I just wanted to give you kind of an official definition of mindfulness. It's just the awareness that arises out of intentionally paying attention in an open, kind, and discerning way. We've seen a lot about mindfulness in the lay press lately, if you've been tuned into that. And here you can see that the research in mindfulness has exploded, in the last 40 years. And my first mindfulness paper, and it was, we tested a mindfulness intervention to help with cancer-related fatigue. And we published that. I got in kind of late on it, but we published that all the way down here. So the train had already left the station when we started doing that. But what we found is that an intervention called mindfulness-based stress reduction that you can get if you flip to the resource page that's the next to the last page of your handout. Brown University offers a lot of training, including this mindfulness-based stress reduction that is now cited in the clinical practice guidelines for an evidence-based treatment for cancer-related fatigue, if that's an issue for you. So, and it's my paper, my team's paper that's cited in those guidelines. Back on this page, you notice how at the bottom, we didn't really talk about the possible barriers, but think about the goal that you wrote down. So like my goal is to do the walking, I'm actually going to do a 30-minute walk tonight when I get home. But I've got to think of what are the barriers that could potentially come up that could get in my way. So one of the barriers is the weather. Like I'm not really a fan of walking in the rain. I said I wanted to walk with my husband. What if he doesn't want to walk? So think of all of the barriers that could potentially come up for you and how you might successfully navigate those barriers. I can get out the big old golfing umbrella so that I don't get wet, and I can ask my son maybe if he wants to go instead. If my husband says he doesn't want to walk, I can ask somebody else to go, or I can go by myself. And then I can do what this lovely lady in the back said that she does, which is I can smell the smells, I can look at the sights, I can get more involved. So think of any barrier that could potentially come up to interfere with you doing your values-based committed action goal. And I would love for some people to shout out a couple of common barriers for you. What's a barrier that might come up? Absolutely. That is the number one barrier that always comes up in groups for sure. And so thinking about, what is your thought about your fatigue and how it impacts your life, if you don't mind me asking?
Well, speaking of lack of focus, usually it's an issue.
Yeah.
It just prevents you from falling into all the way. I've got a million ideas. There are some stuff some people tell you about, but yeah, I have all these ambitions and all these goals. And it's like the ADHD and get home and I'm so tired.
Yeah, exactly. Yeah. So kind of to summarize, fatigue gets in my way of doing all the stuff that's meaningful to me, right? And so do you mind if Kim and I kind of do a little activity that's related to your thought there? Is that okay? And Kim and I have not rehearsed, and we're going to celebrate Kim's willingness to be psychologically flexible here. And we're going to do, hang on one second, I want to flip a slide forward here. So what we're going to do is we're going to play a little tug of war and imagine that this is you, right, whether you're a man or a woman. This is you on the left, and then we've got the fatigue monster on the other side, and that fatigue monster is throwing all sorts of stuff your way. It's like, oh, you can't do it. There's no way you've got the energy to do that. You're washed up, whatever all the thoughts are. But you can see that this guy on the left, he's working pretty hard to fight with this monster in this tug of war. And the stakes are pretty high because I can't tell if you can tell that kind of gaping hole between the two sides there. But if this guy gets pulled over, it's curtains for him. So he's trying to do everything he can to stay out of there. So Kim and I are going to kind of act this out a little bit. All right, and we're just going to do it one-handed, and we're not going to try to hurt each other, right? Yeah. Because you are probably much stronger than I am. So, okay, so right now, Kim is you, and then I'm going to be the fatigue monster, where I'm trying to pull you in to the pit that's underneath here. So, yep. So it looks like we've got a good tug of war going here. It looks like you're stronger than I am too. I'm the fatigue monster, but she's got more energy. But anyway, so we're really kind of caught up in this fight. And imagine that if we were really doing this, we would have both of our hands, we'd have our quads involved, we'd be really going at it. But at this point, what could Kim do to guarantee that I, as the monster, cannot pull her into the pit of suffering? What can she do? Oh, yeah, let go? Yeah, so try that. Right, exactly. That's really smart. Usually it takes people 5 minutes to get to that. But I'm still the fatigue monster. I'm still taunting you, right? I'm saying there's no way. You can't do all those things you want to do. But right now, your hands are free. Your feet are free. I don't have you entangled anymore in this. You're free to do whatever you want. So even if you wanted to go back to your seat, you could even do that right now if you want. Yeah. Yay. Thank you, Kim. That was perfect. But yes, let's please all give a round of applause. So Kim was probably wondering what in the world I was going to do. But I loved it when people said you could just drop the rope, like you don't have to stay caught up in the fight, the tug of war. It takes a lot of energy to stay involved in that kind of a mess. But oftentimes we keep ourselves involved because we're digging in. We're wrapping the rope around our arms. We're calling for help maybe. We're just really dug in. And sometimes all we need to do is the simplest thing, which is I'm going to just notice that I'm upset about this fatigue. I'm noticing my thought that I don't want to have this fatigue anymore. I'm noticing the thought that it sucks. I'm noticing the thought that my heart longs to do A, B, and C, not just A. But what can we do? Like, what is the next step that you can take? What's the action that you can take? What can you do, given the causes and conditions of your life, to continue to live consistently with your values of, kindness and service and empathy, or creativity, or physical well-being, or, love of nature, whatever it is that you value? What can you do? And then just bring whatever it is that you're struggling with, whether it's fear of recurrence, whether it's fatigue, whether it's wondering if your beloved still loves you, whatever it is, you can just acknowledge those thoughts and feelings with a little bit of kindness and compassion, but then get back to doing what is most meaningful to you. So now I always like to ask again, do you guys think I'm full of it? Okay, because every now and then somebody will say like, yeah, that all sounds well and good, but how do I, when I'm so fatigued that I can't get off the couch, how can I live consistently with my values? And, to that, I guess what we would say is, how could you? Is there anything, are there any other values that you have that the fatigue does not have to interfere with? Because I have worked in 25 years of cancer care, I've worked with a lot of people who are actively dying. They don't have a lot of energy to go and coach Little League anymore. But they still have the heart and the passion to do things that are still loving and kind, for their nephews. Even if they can't coach anymore, they can still do other things to show their care and their concern. And so I would just encourage, if you really feel like there's one, symptom or side effect or life reality that's standing in your way and preventing you from living consistently with your values, I would encourage you to think about, are there other ways, other options, other strategies that you could consider trying, even if it's not the same as it used to be or the way that you would most like it to be? Is there another way to invest in what really matters to you? And so we kind of skipped over this page about diffusion. What I mean here is just not letting our thoughts dictate our actions, noticing and acknowledging our thoughts, but not necessarily letting them get us all riled up or tangled up. And this last sentence that we have here, or this last phrase, is one of the best, quickest diffusion strategies that I use 20 times a day. When I'm noticing a thought that is kind of getting in my way or taking up too much of my emotional, physical, or cognitive energy, I will just kind of acknowledge. It's like, oop, yep, there's a thought. I notice that I'm having that thought. And just that noticing, that little piece gives us just a little bit of a space where then we can choose how we're going to respond, rather than letting the thought, kind of tangle us up, like in that tug of war that Kim and I had. It was where she was able to say, it's like, I just don't really want to spend all my energy doing this anymore, so I'm going to just drop the rope. And we probably all have, I know I do, there are certain thoughts that I have a lot, the I'm not good enough, I'm not smart enough, I'm not pretty enough, I'm not, all the I'm not enough kinds of thoughts. So think about all of those thoughts that you have. Make a list of them if you have to. And then whenever they come up, you can be like, yep, there it is. right? Remember that song back in the 80s or 90s? Whoop, there it is. That's what I say to myself all the time. And then I kind of can get my sense of humor going a little bit like, whoop, there it is. Same old, ain't nothing new here. But I'm not going to let it get in my way. And so here, just as we wrap up, just a few loving suggestions for you on how you can increase your ability to thrive as a cancer survivor. First of all, just recognizing, acknowledging with a little kindness any of the sources of stress in your life right now, whether they're cancer related or whether they are other related, but just noticing what shows up in your body, what shows up in your emotions, what shows up in your mind, and then just meeting all of that with just a little bit of kindness and acceptance. And then being able to increase your awareness of the present moment through any sort of mindfulness practice. Informal is just fine. If you don't want to sit cross-legged on a meditation bench, that is a-okay. Recognizing that there is choice. It may not always be perfect choice. We may not always have infinite choices, but we usually have a choice in how we respond to the stuff that life throws us. And I would just invite you to make sure that your choice is one that's consistent with your values, keeping those values top of mind, and then making sure that you are practicing self-kindness by making sure that you are, getting enough sleep, that you're eating nutritiously, that you're moving your body in ways that are healthy for you, and that you're spending time, with people that you enjoy. And then also just, engaging in whatever it is that you're doing, whether it's work, whether it's school, whether it's, your volunteer efforts, just engaging, with your full heart to be able to live as meaningfully as possible. And so I'd like to end today, and we are 2 minutes over right now, but I think we started 12 minutes late, so I think we're doing okay. Anyway, I would like to end with another mindfulness practice, if you are willing. And so for this one, I will invite you once again to close your eyes if you would like, or you can just leave your eyes open. This one will be a fairly quick one. And we call this one a compassion practice. And so I will just invite you again to let your eyes close if you'd like. And perhaps knowing gratitude for all that you brought to this workshop today. Knowing gratitude for all those in the room who did the same. Knowing gratitude for all of the conference planners and all the people involved in making this experience meaningful and successful. And knowing a little gratitude for your willingness and open-hearted courage to participate in this workshop today and to be in the world in ways that you value. To be here in this life as it is, right here, right now. And just holding whatever is here in your heart. You may wish to repeat these words silently to yourself. May I be healthy. No matter what shows up in life, may I know joy. May I tap into the capacity to love and to be loved. May I know peace. May all in this room and beyond be healthy. No matter what shows up in life, may all know joy. May all people tap into the capacity to love and be loved. May all people know peace. And whenever you're ready, slowly allowing your eyes to begin to open. And maybe even taking a peek, if you're in the front row, maybe turning around to look at all the people behind. If you're elsewhere, maybe looking a little bit to the left, a little bit to the right, recognizing that we are in a room full of amazingly cool people. And again, just I'm feeling gratitude for all of you and for your willingness to participate and to do this, because sometimes workshops fall a little flat, but this one was great because of your willingness to actively participate. So the last thing I wanted to mention is that in your handout packet, we have put in a reading list if you're interested. In any books, if what you learned here today was like, you know what, I kind of thought she was full of it, but there were a couple of good ideas. So anyway, here's a reading list. All of these books are fairly compatible with what we went through today. There's also some mindfulness resources for you, including some smartphone apps. The one that's free is the UCLA Mindful, and it's pretty decent. I mean, usually you get what you pay for, but it's pretty darn good. The other ones you do have to pay a little bit for. There's a mindfulness website that has all sorts of free practices on it and some cool readings. And if you want mindfulness training, there's an option there. And then the very last page, if you are willing, I would love for you to fill out the evaluation. And on this page, you can see there's kind of a line towards the bottom. You can tear it in half so that if you fill out the bottom portion, your name wouldn't be on the top portion, because I want it to be anonymous feedback if you're willing to give it. So you can kind of see halfway down, there's, a little bit more than halfway down, there's a line. If you can just rip it there. The bottom part is if you are willing to be part of research planning for our team. I would really love to do a study. I haven't told Clint Carey this, but I would really love to do a study with testicular cancer survivors who are struggling with fear of recurrence to test out some of these coping skills to see if it brings a little bit more peace. These skills work great in breast cancer survivors, in the research that I've done, but I don't know how it lands with men who are testicular cancer survivors. So if you'd like to help inform the work that we do moving forward, fill out the bottom and we'll be in touch to let you know how you can help.
Yeah.
Yeah, absolutely. Well, that's what the literature says, so. Okay, that sounds terrific. And I want to give a big shout out to the Walther Cancer Foundation. Because of their support of my work, I would be able to pay you for your time if you're willing to do a qualitative interview with us to help inform the direction that we move forward in supporting testicular cancer survivors more effectively. So anyway, open for any questions. If anybody needs to run to the bathroom, feel free to do that. Thank you again for your time today. And thank you for tug of warring.